Today, I want to share the top 3 things that my patients are afraid of about the anesthesia before their surgeries. And this is important because 1 in 4 patients will postpone their surgery out of fear of the general anesthesia alone. And a lot of these techniques to overcome these fears can be used outside the operating room as well. Number 1, I'm going to need a lot more pain medications because I have a higher tolerance to anesthesia. I hear this a lot from my patients with red hair or those with Ehlers-Danlos syndrome. We don't quite know why there's some association between some anesthesia requirements and patients who have red hair and Ehlers-Danlos syndrome. But it's only a higher requirement for some anesthesia medications, in particular the anesthesia gas. And even then, it's only like 10 to 20% higher requirements. It's helpful to know the numbers are super low, but you still want to prove to yourself and your anesthesiologist if you have higher pain med requirements. Here's all you have to do. Ask them to inject a little bit of your skin with some lidocaine so you can feel for yourself that the lidocaine or the novocaine or the other local anesthetic medication is working on your body. I've personally never had a patient not feel numb with the local anesthetic injection, whether it be for an IV, a nerve block, an epidural, or spinal, or even if it's injected somewhere else for the surgery. That way, you can prove to yourself that your body isn't immune to anesthesia medications. A lot of my patients might psych themselves out into thinking that they have higher anesthesia requirements, and that psyching out alone and that extra worry and anxiety actually can increase their anesthesia requirements, like a self-fulfilling prophecy. Big fear number 2. Am I going to wake up during my surgery and feel everything that's happening to my body? It's actually super rare for the average elective surgery to wake up or to feel anything in the middle of your surgery if you're under general anesthesia, like with a breathing tube in your mouth. It's like 1 in 10,000. But those numbers might not mean a lot if you're really afraid of that before surgery. Try to transform that fear into a curiosity of what it's going to feel like to be under anesthesia in the first place. You're going to have a few seconds or even a few minutes when you get the first dose of anesthesia before you fall fully to sleep. The more you're prepared and curious about what to expect and what's going to happen to your sense of your body when you're under anesthesia, the greater you can use that opportunity to heal your mind as well as your body during surgery. And that's because some anesthetic medications can actually help with anxiety, depression, addiction, PTSD, and other mental health conditions. But you can't take advantage of that experience if you're not prepared for it. So knowing that being awake during surgery is really rare to start with, try to transform that into curiosity of what it's going to feel like for this brief couple of moments that you're going to be awake before the full anesthesia kicks in. Number 3, I'm afraid of the IV needle going in because it's going to be painful. Every general anesthesia does require you to get an IV needle first, except for some rare circumstances like in young children who fall asleep with the mask and not with the IV. I have a couple very powerful tips for you. Number 1, ask your nurse or your doctor to inject some lidocaine in your skin first with a tiny needle before the IV needle goes in. This is what I do for all my patients. I first inject some lidocaine with a baby needle, like a 30 gauge needle, before the bigger IV needle goes in. That way they won't feel that bigger needle at all when it's going through the skin. Also, I ask my patients to cough to engage all the muscles in their throat as the lidocaine is going in, because engaging all the muscles in your throat helps distract your brain from feeling the pain of that baby needle going into your skin in the first place. Between the 30 gauge needle for the lidocaine to numb your skin and the coughing as that 30 gauge needle is going in, most of my patients don't even feel the IV needle going in at all. Did I miss any other major fears that you've had before surgery? Let me know below.